Mr Andrew Selous.
Well, thank you very much indeed, Madam Deputy Speaker, and I'm grateful to Mr Speaker for granting me this debate. For many years, I've championed the issue of supporting as many people as possible to achieve a healthy weight, an important issue in health prevention which matters today more than it ever has. It's also so important to remember that even if achieving a healthy weight is a real challenge for you, the more physical activity you can do, the better, even if your body mass index is not yet as you would want it. Tonight, I want to issue a call to arms on the related issue of being sufficiently physically active to help us all lead healthy lives. And I want to start by paying tribute to Peter Walker, a parliamentary correspondent who works in this building, for his outstanding book, The Miracle Pill, published last year, which I think should be a required reading for everyone working in health and social care, and for everyone who cares about the NHS, and for leaders across central and local government, as well as in business. So let's start by looking at the health benefits of regular physical activity, and if we could achieve these outcomes with a pill, it would indeed be the miracle pill. Regular physical activity reduces your risk of breast cancer by 20%, your risk of dementia, depression and colon cancer by 30%, your risk of cardiovascular disease by 35%, and your risk of type 2 diabetes by up to 40%. Hip fractures, which are so often catastrophic in their consequences for the frail and elderly, are reduced by up to a whopping 68%, Madam Deputy Speaker, by regular physical activity, and these are all NHS figures. Now, I am very grateful for the good work of the Faculty of Sport and Exercise Medicine UK, for their Moving Medicine programme designed to promote a person-centred approach to physical activity and health, for their Active Hospitals programme, which focuses on delivering physical activity through secondary care, and both programmes have won awards from the Royal College of Physicians and have now been adopted in Australasia and the United States. Active Conversations is also an excellent training course to increase physical activity for all health and social care professionals, social prescribers and the fitness industry. It's also good to see the Office for Health Improvement and Disparities, a very important new part of the Department of Health and Social Care, have a number of important online resources on physical activity and health, including in the treatment of long-term conditions. As another leading academic in this area, Ralph Paffenbarger, says, anything that gets worse as you grow older gets better when you exercise. Or as another public health expert puts it, slightly more bluntly, being active throughout your life is being able to get to the loo on time in your old age. On that point.
Not as one who has to get to the toilet early, Madam Deputy Speaker, but can I make the plug? First of all, can I congratulate the honourable gentleman for South West Bedfordshire for bringing it forward. And I spoke to him beforehand. I'm making a plug for children to do it early when it comes to physical and health conditions. In Northern Ireland, 20% of children are classed as overweight, 6% are classed as obese. I understand those figures are reflected in the mainland here as well. There's a need to change the way we are doing things is very clear, and that targeted funding for children in schools, which I say has fallen aside, by the wayside due to COVID, must be re-established. I think the honourable gentleman agrees with that, and the importance of daily mile walks must be promoted in every region of the UK. Start it early, and then in late stage, Madam Deputy Speaker, you won't have to run to the toilet.
Well, I'm very grateful to my honourable friend. He's absolutely right about the Daily Mile, and I thank him for championing that in Northern Ireland. It will absolutely make a difference, and I hope he can encourage, indeed, all the schools in Northern Ireland to take part. So, Madam Deputy Speaker, how are we doing as a nation in achieving the necessary levels of physical activity? Not very well at all, I'm afraid, is the answer. According to the briefing I've received from the Royal College of General Practitioners, 34% of men and 42% of women in the UK are not active enough for good health. They also tell us that physical inactivity is responsible for 1 in every 6 UK deaths, the same as caused by smoking. 27% of the population are classified as inactive meaning they do less than 30 minutes of moderate physical activities, such as walking, each week. And it's getting worse. By 2030, we are on track to be 35% less active than we were in 1960. And most shockingly of all, a third of children do less than half the recommended physical activity for their age. Indeed, the 2015 NHS Health Survey for Children actually had even worse findings, showing fewer than a quarter of children reaching the required minimum of 1 hour moderate to vigorous physical activity on average every day across the week. And I think it's worth pausing on that last point to consider what we do about that. The curriculum is very full, and the Department for Education are reluctant to mandate physical activity. The Department of Health and Social Care's remit does not extend to the ordering of the school day. So do we need the Cabinet Office to start taking a serious cross-government interest in this issue for children and indeed throughout later life? So what will happen if we continue on current trends? Justin Varney, formerly head of adult wellbeing for Public Health England and now in charge of public health in Birmingham, says, and I quote, "The whole concept of an NHS and welfare state, in whatever form we have it, is completely unsustainable if a third or more of the population remain physically inactive." And it's not as if we've just realised the importance of sufficient physical activity to our health. Back in 1948, Dr. Jerry Morris was appointed as the first director of the Social Medicine Unit, a government-backed body tasked with examining how health issues interact with people's circumstances. His major initial research was to look into why the drivers of London's double-decker buses had sufficiently higher rates of heart attacks than their conductor colleagues. And his conclusion was that the only real difference between the groups who were from identical backgrounds was that the former spent their day sitting down, with the latter constantly on their feet going up and down flights of stairs. So the hard facts are that for many of us, the way we work and the way in which we travel is taking years off what should be our healthy life expectancy. So this is a really big issue which, quite frankly, is not remotely getting the attention it deserves. So what can we do about this? The answer is a very great deal if we have the political will and really value our NHS rather than just paying lip service to it, and if we follow the academic research and learn from existing best practice around the world. Enabling active travel is the single biggest health intervention the government could make. Walking and cycling are the easiest ways to integrate physical activity into our daily lives. 2/3 of journeys in the UK are under 5 miles and could be cycled by those who are capable in half an hour, yet only 2% of trips are cycled, and of course e-bikes help the elderly and those in less good health and make cycling much more inclusive. Staggeringly, 1.5 billion journeys of less than a mile are driven in cars every year. So there is an enormous potential to do better. Active travel for children can contribute 23% of the moderate to vigorous physical activity needs on school days for primary-age children and 36% for secondary-age children. People who cycle to work take fewer days off sick than their car-driving colleagues, so it's good for the economy. And if you're not tempted so far to consider your daily commute by bicycle, then you should have read the 2017 British Medical Journal article by Carlos Chelis Morales, which used the biobank data to follow 250,000 people over 5 years. And this showed that you had a 40% less chance of dying in the study period if you commuted by bicycle. Now, I'm absolutely among those who want cycling to be for the many and not the brave, and we do need our roads to be safe. But the statistical reality is that for many of us, it's far safer to be on a bicycle than in a car or on the sofa in terms of our health. Now, I do support the work the Department for Transport is doing to deliver the Prime Minister's vision for half of all journeys in towns and cities to be cycled or walked by 2030, which is being supported by a £2 billion package of funding for active travel over 5 years under the inspirational leadership of Chris Boardman, the interim Active Travel Commissioner for Active Travel England. The plan includes delivering safe routes for cycling and walking, cycle training for all children and adults that want it, creating active travel, social prescribing pilots. Employers who care about the well-being of their staff as well as the productivity of their businesses should be right behind this. And I'm also looking forward to the publication of the second four-year statutory cycling and walking investment strategy this spring to reflect the new policies in gear change and the multi-year funding settlement from the spending review. And this is not a pipe dream. It's happening now in Copenhagen, with 40% of commuting trips are made by bike, and I suspect it's not much less in Amsterdam either. Now, this didn't happen by chance in either of these cities. It happened because of visionary leaders who cared about the well-being of their residents and who pursued this policy over decades. And we can do more in the workplace as well. The Googleplex offices in Mountain View, California, are designed to encourage as much physical movement by staff as possible, and this includes using nature between buildings as well as what happens in them. Most of the workspace is on the second story, and all the meeting rooms, cafes and every single toilet, apart from the accessible ones, are on the ground level, connected by courtyard-style staircases. So what are UK businesses doing to build some mobility in what has become an excessively sedentary culture? Sitting still for too long is not good for us. I've come across one defence minister, one female general, one House of Commons clerk and one Hansard recorder who conduct meetings or who have a standing desk. It's the exception rather than the rule, and when I had the pleasure of discussing Peter Walker's excellent book with him recently, I made sure we did so walking around St James's Park. Now, I do wonder whether the Department of Health and Social Care and, Madam Deputy Speaker, the House of Commons Commission have looked at the Be Upstanding programme, a free, world-leading project that improves the health and well-being of desk-based workers. If not, why not? I mentioned earlier that only between a quarter and a third of UK schoolchildren are undertaking the recommended amount of physical activity. I'm a huge fan of the Daily Mile, already referred to by the Honourable Member for Strangford, where children run or walk a mile at the start of each day. There are 7,289 schools in England doing this, 1,191 in Scotland, which is commendable, and I'd like to see that number grow substantially, including in Wales and Northern Ireland. There is another country in Europe, however, which is doing even better, with a global report card showing that of the 49 countries covered, Slovenia has the best results for activity levels in children, with more than 80% of those aged 6 to 19 meeting the 1 hour a day threshold for activity, and that frankly puts the United Kingdom to shame, notwithstanding the tremendous Daily Mile initiative. Again, this didn't happen by chance. It's a conscious decision which has equipped every school with 2 gyms, an outdoor play area, as well as track and field facilities with 5 sports days per year and another week off for outdoor activities. I do wonder whether we fully use the fantastic expertise of our diplomatic network to really understand best practice in public health around the world. And if the Department of Health and Social Care is unaware of the level of commuting in Copenhagen or the outstanding physical activity achievements of Slovenian children, then I would urge the Minister to speak to her colleagues in the Foreign Commonwealth and Development Office to make sure the relevant briefings are provided to her and her officials so we can copy what is working well elsewhere. As I finish, Madam Deputy Speaker, I think it's really important to emphasise that even if we can't do our 10,000 steps every day, or 150 minutes a week of moderate exercise, or 75 minutes of intense exercise, then every little helps. It's also really important to understand the difference between formal activity and incidental activity. Sport is brilliant. I want to see as many people as possible, of both sexes and all ages, participating, but the evidence suggests that the biggest gains will be from the minor adjustments we make in our everyday lives, such as using the stairs rather than the lift, getting off the bus one stop early, finding a parking space some way away from your office or meeting, or taking up a hobby you enjoy like dancing. One of the best things that the Whip's office has ever done for me is put me on the 5th floor of Portcullis House, giving me the opportunity to climb the 137 steps to my office on a regular basis throughout the day. I'm not sure it was meant as a favour, but I am genuinely grateful. But I do implore the whole of central and local government to wake up to the importance of this issue and for all of us to play our part in keeping active as possible in every way that is open to us. With good policies, with political will, we can make the right thing to do, the easy and affordable thing to do for more and more people.